Hello, my name is Rebecca Guitron. This presentation will be about women and heart disease. I am an LPN student at the Indiana State University, and this video is on behalf of the Community Health Nursing course, Nursing 444. The population at risk that this video will be focusing on is women. Although men and women do get heart disease, we will be focusing on women as it is the #1 killer of women in the U.S. Women aged 65 and older in particular are at highest risk. Heart disease may look like many things. For example, heart disease could be coronary artery disease, heart attack, arrhythmias, heart failure, heart valve disease, and there are many more. Despite the awareness of heart disease, only 56% of women are aware that it is the #1 killer of women, according to the Centers for Disease Control and Prevention. Heart disease is responsible for approximately 1 in 3 female deaths in the U.S. And about 1 in 16 women aged 20 and older have coronary heart disease, also according to the Centers for Disease Control and Prevention. Heart disease is the leading cause of death in women in the United States, more than all cancers combined. And heart disease approximately kills 500,000 females each year in the US. At this time, please pause the video to take the pretest, which is located below this YouTube video in the description box. There is a link to follow for the pretest. When you are finished taking the pretest, please resume the video. Thank you. Learning objectives. The learner will recall common misperceptions about heart disease and women. The learner will identify common symptoms of heart disease in women. The learner will identify the risk factors for heart disease in women. And lastly, the learner will list ways to reduce the risks of heart disease in women. Some common misunderstandings of heart disease. Heart disease has long since been considered a man's disease, although there is growing awareness that women are also affected by heart disease, just as much as men are. Another misunderstanding and misconception is that the outcome for women versus men is worse, despite women tending to develop heart disease later in life by about 10 years. This means that a woman is more likely and tends to develop heart disease when she is at an older age, whereas men are more likely to develop a form of heart disease at a younger age. And yet women still have a worse outcome. According to the American Heart Association, AAH, almost 50% of women believe that men are more likely to develop the heart disease. This is very untrue, yet it is still a common misperception that is circulating in the community of the US. As of 2017, approximately 60% of women believe that cancer is their #1 killer, when actually heart disease is. And quite possibly the biggest misperception and misunderstanding of heart disease is that women should present the same for heart attack as men do, when in reality, women have different symptoms of heart attack. What are the symptoms of heart disease in women? Specific to women, heart disease may appear as nausea, and this could be during rest or exercise, dull or heavy, sharp pain or discomfort in her chest, as well as pain in the neck, jaw, and or throat, pain in the upper abdomen or back, vomiting, during rest or exercise, as well as fatigue during rest or exercise. Men may develop these symptoms of heart disease as well. However, in women, it is often overlooked, especially when she may only have one or two of the symptoms of heart disease. Symptoms of heart attack in women also differ from the symptoms of heart attack in men. Even though both sexes may present with similar or even the same symptoms, one hallmark symptom of women and heart attack is indigestion. Again, men may experience this symptom or other symptoms. However, women are more likely to experience this, and women are more likely to overlook the indigestion symptom. Other symptoms of heart attack in women include chest pain or discomfort, upper back or neck pain, the indigestion as mentioned before, shortness of breath, nausea with or without vomiting, extreme fatigue, dizziness, as well as overall upper body discomfort. The symptom of arrhythmia in women is also the same as it is in men, and it is fluttering feelings in the chest. These sensations may or may not be experienced with pain. If it is experienced with pain, usually that is indicating something in addition to the arrhythmia. It goes without saying that if you are experiencing fluttering feelings in the chest or any symptoms, then you should go to your doctor and get checked out. Symptoms of heart failure are also the same in men as they are in women and include shortness of breath, fatigue, and the swelling of feet, ankles, legs, abdomen, and neck veins. What are the risk factors for heart disease? In general, the risk factors for heart disease present themselves with men and women and include being overweight or obese, having diabetes, eating an unhealthy diet, lack of daily exercise, excessive alcohol consumption, smoking tobacco, having high cholesterol and triglyceride levels, repeated high stress or chronic anxiety, and having close relatives with heart disease. Some things that you can do to reduce your risk of heart disease include quitting smoking, limiting your alcohol intake, making healthier food choices, exercising daily, knowing your risk factors, see a doctor for the cardiac risk assessment, knowing your blood pressure and cholesterol levels, as well as your overall risk for heart disease. These are the references used in the making of this video. At this time, you may now take the post test, which is located in the description box below the video. Also take a look at the handout provided in the description box as well under a link. Thank you for watching.